Staten Island's hospitals, they're taking on an influx of patients. Staffing those facilities has become very problematic. Last night, the borough president tweeted out the chase for staffing help for Staten Island's hospitals is on again, albeit right now, not at the level of these horrific days earlier in the COVID pandemic back in April. So what's next in controlling the spread? Here with us right now with an update, Staten Island Borough President James Oddo. Good morning to you, Mr. Oddo. Thanks for being here.
Good morning. Thank you for having me back.
Of course. So let's talk about the hospitals first and foremost. You're seeing staffing at hospitals. Are there issues with the bed capacity right now, since the numbers are trickling up as we approach that post-Thanksgiving peak?
That data tell an important part of this story. So the last time I appeared on PIX was November 24th. 2 days before that, the COVID population at Staten Island University Hospital was 23 people. This past Friday, when I was talking to the executive director of Staten Island University Hospital, Dr. Brahim Ardolik, he told me his COVID population is now 181.
Wow.
4 hours later, when he addressed all of the elected officials on Staten Island, the population was 188 people.
Wow.
Last evening, it was 199. The smaller hospital on Staten Island, Rumsey, has 40 folks who have COVID, 12 of whom are in the intensive care unit. And this is not the full brunt of Thanksgiving yet. We are still in the accumulating stage. And
when would you be at capacity? When would you be at capacity?
Well, we still have a ways to go, made somewhat better by the fact that the governor turned on a field hospital at the South Beach Psych Center, which allows Staten Island University Hospital and Richmond County Medical Center to decompress by taking folks who have been stabilized, but some of whom can't go home yet, and sending them to the South Beach Psych facility that's been made into an extension, essentially, of a hospital. You mentioned staffing. We are seeing, as we are seeing on Staten Island with the Department of Sanitation, we are seeing our front care workers in the hospitals become ill again. Rumsey, again, the smaller of the two hospitals, has put in a request for 15 ICU nurses and 15 med-surg nurses. 30 folks they need already. And again, we are not at the peak of the impact of Thanksgiving.
So let me ask you this, because we see schools are reopening today. Many people wanted schools to reopen, right? First, let me get your thoughts on that.
Yeah, I think my North Star has been science, and let the science guide the policy. And the science across the country is, in fact, that the school population inside the schools, the positivity rate is much lower than outside in the community. And we are losing so much. These kids are losing so much. And to whatever degree we can keep schools open and while keeping everyone safe, I think we need to try that. And I think it's taken everybody by surprise how well we have done in terms of the positivity rates in the schools. So we got to keep them open as long as we can. And that's why it's so important for Staten Islanders to step up, as fatigued as they are, and continue to do what the best scientists and medical experts in the world say, and that's wear the mask and socially distance.
So let me ask you this then, because it seems like on Staten Island there may be a bit of a divide then about not only mask wearing, but some businesses that are shut down, specifically the Max Public House, which has been open and closed a number of times. We're seeing this. We're seeing people come out together to rally around Max. They're not wearing masks. How do you bridge this divide of mask wearing? And also, what are your thoughts about the specific establishment that keeps opening and closing?
The juxtaposition of the events of the last week and a half about that one location, the juxtaposition of what we saw happen to the conversations I have with the leaders of our two hospital systems is startling. There's an incredible divide. The frustration, dare I say, the desperation of small business owners are real, but what we saw unfold for the last week and a half has helped no one. It hasn't helped that institution. It has helped no hospital or no restaurant or small business on Staten Island. And it's hurt Staten Island in the eyes of the rest of New York City, and it is damaging. Listen, you lose me with autonomous zone. There's no such thing. Whether you're in Seattle, you're in City Hall Park, or in front of a bar in Staten Island, there's no such thing. We don't get to pick and choose. And while there are legitimate, genuine arguments to be made how there has not been that level of urgency needed on every level of government to help these folks, you can't go out and engage in the behavior that we saw. It only brings about the very restrictions that you're bristling at.
And lastly, and first off, let me just say this: nobody wants to see a small business close. They're the lifeline of these communities. So I do understand the pain they're going through. We only have 20 seconds left. How do you bring the community together when there is such a divide right now about so many things regarding coronavirus?
I wish I had an answer to that. If truth and facts and science and conversation itself keeps inflaming, I don't know where that leaves you, but I'm just going to continue to follow the science and echo what science says and hope that at some point the message finally sinks in.
Understood. Borough President James Oddo, thank you for being here this morning. Do appreciate your time and the update on the hospital numbers. Stay safe to you.
Thank you.